All right, when you're dealing with a major trauma, some signs are pretty obvious. But what if one of the most critical, life-saving clues is the exact opposite of what you'd expect? Today, we're going to dig into a real medical paradox that can make all the difference when every single second counts.
So let's just jump right into the big question. Picture this, a patient with massive chest trauma, bleeding internally. Is it possible that a chest literally filling up with blood could cause the neck veins to look, well, flat and empty? I mean, it seems logical, right? More fluid should mean more pressure, more bulging.
And the answer, which might surprise you, is a huge yes. It's not only possible, it's actually a classic clinical sign. And, figuring out why this happens isn't just trivia. It's a life-saving skill for any first responder, because it helps you pinpoint exactly what kind of emergency you're dealing with.
So, okay, how on earth is this even possible? Well, the science behind it is actually pretty fascinating, and it all boils down to something really simple: where the blood is going, and more importantly, where it's not going anymore.
So the condition we're zeroing in on here is called a massive hemothorax. And the key word here is massive. We're talking 1.5 liters of blood or more pooling in the pleural space. That's the area right between the lung and the chest wall. I mean, that is a catastrophic amount of blood loss. It's just all happening on the inside. Okay, so think of this as a kind of chain reaction. First, you've got this huge blood loss, but it's pouring out of the circulatory system and into the chest cavity. That right there causes hypovolemia, a sudden, dramatic drop in the total amount of blood inside the veins and arteries. And with less blood in the whole system, well, you've got less blood making its way back to the heart. And the result of all that, the big jugular veins in the neck, which count on that returning blood to stay plump, just don't have enough volume to stay open. They collapse and look flat. And here's why this all matters so much. This isn't just cool physiology. It's a super powerful diagnostic tool. When you're in the middle of the chaos of a trauma, you've got to figure out, fast, if you're dealing with a hemothorax or one of the other really nasty chest injuries. You can kind of simplify your thinking into two main buckets. Are we looking at a pressure problem or a volume problem? If you see bulging, distended neck veins, that's what we call JVD. That screams pressure problem. Something is backing up the whole system, like trapped air from a tension pneumothorax or fluids squeezing the heart in cardiac tamponade. But flat veins, that points you straight to a volume problem. The tank is running empty. The patient is bleeding out somewhere. Now, when you combine this clue with what you're hearing in the lungs, that's when the picture gets really clear. For a hemothorax, you've got the flat neck veins, and you hear diminished lung sounds on one side. Obviously the side that's filling up with blood, but contrast that with a tension pneumothorax. Now you're going to see distended neck veins because of all that pressure, but you'll still hear those diminished lung sounds on one side. And then there's cardiac tamponade. The heart's getting squeezed, so the veins are distended, but the lungs themselves might sound totally fine. See, just two signs, neck veins and lung sounds, can help you tell these killers apart in a hurry. All right, so let's boil all of this down. What's the one big takeaway here? Let's turn this into a simple, clinical rule of thumb you can actually use out in the field. This is it. This is the clinical pearl you've got to remember. You walk onto a scene and you find a patient with hypotension, so dangerously low blood pressure. You look at their neck and see flat veins. And you listen to their chest and hear decreased breath sounds on one side. When you see that trio, that triad of signs, massive hemothorax needs to be way, way up at the top of your list. See? Each one of those signs tells you a critical part of the story. The low blood pressure and the flat veins tell you the body is losing a massive amount of volume. And those quiet lung sounds, they pinpoint exactly where all that volume is going, right into the chest cavity. It's really an elegant and incredibly powerful piece of diagnostic work. And that really brings us to a final critical thought. We've just taken apart one classic sign that can be super misleading if you don't understand the why behind it. It really makes you think, doesn't it? What other clinical rules of thumb, these classic signs we rely on, might actually be misleading us? That's a crucial question for anyone who works in trauma. Thanks for tuning in.